Savannah is part of something that the Center for Disease Control calls the Diabetes Belt.
November is National Diabetes Awareness Month, and SouthCoast Health in Savannah has a diabetes management program. Here to tell us all about it, Dr. Regina Dandy, a family medicine and primary care physician at SouthCoast.
Good morning, how are you?
Good morning.
I asked you a little bit before you sat down, what is the Diabetes Belt?
The Diabetes Belt basically consists of the southernmost states. Georgia is part of that southern belt. Mississippi, South Carolina, North Carolina, they lead the country in the highest number of diagnoses and cases with diabetes.
Wow. Is there a reason?
Well, a lot of it has to do with lifestyle, our culture. 1 in 10 Georgians have been diagnosed with diabetes. 6.5% of those folks who have diabetes are unaware that they have diabetes. The death rates from diabetes, Georgia is about 8% higher than the national average. The cost to treat diabetes back in 2013 topped $5.1 billion in the state of Georgia. 3.3 of that was direct medical cost, and about 1.8 billion of that, was due to lost productivity and sick days.
Yeah, because it goes out from there. There's ripples. So,
yes.
So obviously this is a good place to have a dedicated diabetes wellness center.
Yes, and it's not just a local problem, it's a national problem. There are 30 million folks in this country with diabetes. 1 in 9 of every U.S. citizen here has diabetes, and so 23 million of those folks who have diabetes are up there in age. So it's to our advantage. It's $245 billion in cost annually to treat that.
Yeah, tell us about this program at SouthCoast.
Yeah.
So SouthCoast Health has a diabetic management program, and its basic goal was aimed at providing better health care to our diabetic patients. So it's basically directed at giving our patients the skills that they need to help influence their clinical outcomes, their quality of life and living with that diagnosis, and their overall health status. So the sessions consist of a healthcare professional that kind of leads the group, and in each group consists of our diabetic patients, their family members. And so they cover a wide range of topics that basically get them motivated and educated about health, increasing their physical activity, better nutrition, how to take their medications, and just better overall quality of living with diabetes, how to monitor their blood sugars. So,
if somebody's hearing all this and says, I have a family history, what do they do? How do they get in touch with you and SouthCoast?
So basically, you can look us up at southcoasthealth.com. We have multiple locations around the city, the Bluffton area, Effingham. Not just with SouthCoast, but obviously if they're a primary care physician as well. So some of the risk factors, not just family history, include age over 45. If you were pregnant and you had diabetes, we call that gestational diabetes. Obviously, family history, obesity. 27% of the folks in Georgia are overweight or considered
And this is the
obese.
month, again, it's Awareness Month, so this is the time to get that word out. Doctor, thank you so much for
Thank you so much.
The holidays will be hopping at the Westin. That's next.